Okay. Is it recording?
It says it does. Yep.
Okay. Um, I just want to welcome everybody to tonight's call with Dr. Aspig and Hillary. I'm sorry, are you a doctor also? No? Okay.
Not yet. I'm working
Almost,
on it.
almost. And the great folks from NDCPD, and they're gonna present to us from the Deaf Blind Project. And this one is on early identification. And we're also really pleased that the project officer for the Deaf Blind Project, Rebecca Sheffield, is with us tonight too. So I'm really anxious to hear about this. And like I said, we'll record this. And for those that miss, we'll make sure that it gets up on our Family Voices website and send that information out so you can share it with the folks that you are also working with on the Deaf Blind Project as well. So thank you everybody for coming. And Brent, I'm just going to let you go ahead and take it away. I have you as co-host.
Okay, thank you, Deneen. And I just want to thank everybody for taking the time and spending the time with us this evening. I'm Brent Askvig. I'm now partially retired. I'm no longer the director at the Center for Persons with Disabilities, and I'm from my permanent office, my home office here in Minot at my house, and just happy to be with all of you tonight to talk about early identification and referral for children who are deaf-blind. And my co-worker and now the Associate Director of NDCPD is Hillary Lashini. Hillary?
Hi, everyone. Yep, I'm the new Associate Director at our center. But for the Deaf Blind Project, I serve as the Family Engagement Coordinator. So I do a lot of outreach to families of children who are deaf-blind, providing resources and getting them into contact with the appropriate professionals across the state or nationally.
And so the idea tonight is that we'll go ahead, hey Roxanne, we'll go ahead and we've got a slide presentation here. We will have, or Deneen actually has copies of that. I think she has everyone's email. She can send that out to you if you haven't already seen it. And we'll go through this. And if there are questions along the way, please go ahead and feel free to ask. You can go ahead and interrupt us verbally. You can go ahead and put a note down in the chat box. I'm going to guess most of us have used Zoom a little bit here this last 365 days. So we probably are familiar with how we can do that. So we certainly welcome that. We'll have about 20 to 30 minutes of that, plus then time for questions and discussions. And we'll probably even ask for your opinion. And I know several of you would be willing and certainly able to do that. So I'm going to go ahead and share my screen.
I don't know who you were referring to, Brent.
I didn't name names. So the title is Early Identification and Referral. A little bit about our project. We're funded primarily through the Office of Special Education at the Department of Education, U.S. Department of Education. And this project has been funded in one form or another since about 1972 for the state of North Dakota. It's been housed at various places. It first started at the institution in Grafton in 1972-73, and Dr. Ron Archer and others started the program there with different kinds of funding in different ways, and it was a response to the thalidomide and the measles epidemic in the United States, and what we're trying to figure out how to support children. And at that time, it was mostly a service delivery program. In other words, they were trying to find the children who fit the deaf-blind definitions at that time and trying to make sure that they could provide direct services. And if you recall, that's before the 94-142 or the public law. Currently, the project's format and form is technical assistance and training, information, resources, referral, that type of thing. So that's what we do. That's where we're at. We're again thankful that our project officer is with us tonight, and we will have a disclaimer at the end to make sure that folks understand that this is our information and may not necessarily be the official policy of OSEP. We really look at technical assistance and training and support for educators and families, children birth through 21 who are deafblind. So the question always becomes, what's deafblind, right? And that's a long question, standing question. It's a question that every year at our gatherings together of projects and project directors, there's always discussions. There are new projects and new people coming on and deafblind. This goes back to IDEA. That's what we're showing you tonight. Deafblindness means concomitant hearing and visual impairments, the combination of which causes severe communication and other developmental and educational needs that they cannot be accommodated in special ed programs solely for children with deafness or children with blindness. And so that's all well and good, and that's the official definition. We break that down a little bit to kind of explain some of the things that are going on here. The first is, well, what does concomitant mean? Well, that means it's associated or linked or connected somehow. And the person has some vision and hearing impairments. They're both present and they're connected. Those impairments are connected in such a way that there are problems in communication and other developmental and educational needs in these children. That's the next kind of a little bubble there. About 90% of the children who are deafblind, and this is US wide, have multiple support needs. They need support in multiple developmental areas and multiple education areas. And often we might think of deafblind as simply someone who just doesn't hear or doesn't hear well or doesn't see and doesn't see well, and that's it. And that's really not the case. Most of our students, and we'll give you some information about the children that we're serving in North Dakota, have multiple issues and support needs. And then the third point is cannot be accommodated in special ed programs solely for children with deafness or children with blindness. The pairing of those is not just an additive factor. They have a hearing loss or are deaf, they have a vision loss or are blind. It's not just kind of piled on. It really becomes intertwined. It's connected. It is really a complex situation. And trying to figure that out and how that all works or gets in the way of learning is really pretty complex and very, very individualized. So who are these children who fit that definition in North Dakota? And I'm going back to our data from our child count, our census in North Dakota that we do every year. In fact, we're right in the middle of that right now. There were 37 children on our census, and this would have been a December 2019 count. 2 children that would be in what we'd call early intervention, birth through 2. 8 children in that 3 to 5 or preschool age, elementary or at least early elementary. There were 12 children in that 6 to 11 age group, 9 children in 12 to 17, and 8 in the 18 to 21 group, there were 5. So we have those children split into those different, so it's a whole entire group, but you'll see the smallest group are those children who are in early intervention, who are very young children. That's the smallest group, that 2 children birth through 2. Now I need to tell you, we're excited about that number 2, because before that the number was 0, and then the number was 1. And that's why we're talking about early intervention and, early identification and referral. We know that these children have more than deafness and blindness going on. They have lots of other supports. So we know that there are other things that may be priorities in their lives and trying to identify them and what kinds of support needs that they have. But it's not as if we didn't know that they have these problems, but we're not finding them on our census. So that's one of the purposes of this tonight. Of those 37 children, 29 of those have at least one, and many have many more, or more conditions beyond deaf blindness. 7 have cortical vision impairment. 21 have complex healthcare needs. Orthopedic and physical impairments, 24 children have. Charge syndrome, a very specific category of deaf blindness. There are 5 children, 4 who have Usher syndrome. Now, if you've worked with us before and been involved in our census, you know our census form has about 70 different conditions on there. And these are the most common. These are the most common that are on there. So again, children with lots and lots of support needs. And so again, we want to talk tonight about early identification. We want to talk about referral to those children. And we often are asked, well, why are you interested in that? Why are you worried about that? Well, first of all, part of our project responsibilities are to make sure that we conduct a census every year. That's something that we do, something that we're happy to do and be involved in. But in doing that, again, people are saying, well, why? Well, one of the uses of those data is to kind of determine the prevailing causes or conditions within the population. So I'll give you an example. Cortical vision impairment, 7 of our 37 children, or 20% of our kids, have that. Cortical vision impairment can cause all kinds of issues in learning that, again, are compounded by loss in hearing. And we've had a number of children with CVI where people are, the educators are looking at these children and trying to decide, well, what do we do and how do we handle these kinds of situations? Well, knowing that we had a large number, percentage of those children, we spent some project funds in assuring that some staff in North Dakota were trained in CVI, or cortical vision impairment, assessment techniques and in intervention techniques. And so we were able to sponsor some training for them. So knowing what some of the prevailing conditions are allows us to make sure that we're going to use our money in an appropriate way for a larger number of students. The second is to look at the nature of the services that are received or by children, or that are needed by children and families. So, many of you know that what Family Voices and Deneen's program does in making sure that there's supports for families and children, particularly with complex healthcare needs. And you saw how many children on our census have those, and trying to determine who knows what about what. So how do we make appropriate referrals to the services that families or the services that providers might need to know about for these children? The third is preparing personnel to work with specific needs. So I already talked a little bit about CVI, but you're familiar, some of you are, with a summer institute that we did last year, where we focused on a number of different factors that were important for educators in providing services to children who are deaf blind. And we were really involved in asking them about the things that they need and the things that they need to know how to do within their professions to be able to support these children. And we organized our institute around that. And in fact, we're organizing that in another institute this coming year around those needs. We need to be providing technical assistance and training for families, for early intervention providers, for school personnel. I was just in a school last week, and we had an outreach staff from the School for the Deaf, outreach staff from School for the Blind. The principal was there, speech language pathologist was there, the classroom aide, the kindergarten teacher, the special education staff, and I was there, the regular, the other regular ed teachers, even the lunchroom person, staff. There were a lot of people that needed support. And in fact, the kindergarten children who were saying, so why is Sarah, Why is Sarah with us? Why is she in kindergarten with us? What is she doing? And so we're able to provide some technical assistance. We're able to be there to see what's happening and see how we can support them. And part of that is getting information out, getting resources out. We're one of probably, I'm going to probably get this wrong, Rebecca, but I think we're one of probably 45 to 50 programs across the United States that provide services within our own state or our own geographic region, maybe a couple of states together in some situations, but we're linked to them. We have a national support center for our state projects, but that's also accessible for families, for teachers, for principals, for other providers too. Lots and lots of great resources. And as we said, we participate in that nationwide census process. So we want to make sure that we're doing this for the right reasons. And so how can we do that? How can we find these children who have these concomitant deaf, blind conditions who need extra supports? How do we find them? Well, making sure that they have access to and providers can provide accurate screening and clinical diagnostic measurements of hearing and vision. So we could work with audiologists, we could work with optometrists and ophthalmologists, we could work with a large number of people in doing that. Functional evaluations. One of the things that happened at our site visit last week was that a functional, let's see, this would have been functional hearing evaluation was also occurring at the same time. We can look for links to specific genetic and postnatal conditions. We want to find out where those might be occurring and let people who make those diagnoses in the medical field aware of the services that we're able to provide. We look at educational labels, either from IFSPs or IEPs. And I need to tell you that North Dakota, like many other states, doesn't have a lot of children on our IDEA child counts who have a primary or a secondary diagnosis of deaf-blind. That's not uncommon for states. That's not a requirement to be on our census, and we never ask that the IFSP team or the IEP team change the labels or the diagnostic identifiers that they use in their documents. However, we do know that they're often associated with other characteristics. It might be a vision, it might be other health impaired, it might be a physical disability they put on those documents, and we're able to try and find that there are other conditions that are also occurring. And then we can identify children who might have some diagnoses that are suspected, but aren't quite yet confirmed because they need some more testing. So one of the options for being on our census and being identified as deaf-blind for our census and being involved in our project is that we suspect there's a vision loss, but we don't have all of the necessary evaluation criteria to meet that yet. And we have an evaluation coming up, but it's not there. We've got a time frame to be on the census. You can go ahead and say, we'll put you on the census that it says, further testing needed. And that will allow you to get involved in our project and involved in a lot of things that are going on here with this. So. In an early child screening, lots of things that are going on. We have partners with our EDDI project, our Early Hearing Detection and Intervention project. You know that there's a screening process that goes on. We'll actually talk a little bit about their 136 format here in just a little bit. There's vision screening that goes on through the North Dakota School for the Blind Vision Services program. We've actually partnered with them so that they have provided vision screening testing now to all of the early intervention programs in North Dakota, so that those early intervention providers can actually do some vision screening to kind of keep the process going to see if in fact that truly is an issue that needs addressing. And then getting to physicians, to getting to, as we said, optometrists, getting to audiologists on all of those hearing and vision screenings. There are general developmental screenings that go on. Head Start does screenings, preschools, school districts do screenings. Some medical facilities and programs in our state do screenings. I know that Hillary is involved with promoting not only general developmental screening, but autism screening in North Dakota, and helping folks who do those understand what's happening. Physician screenings at well child checkups, or 1, 3, 6 month checkups for young children. NICU or newborn intensive care unit clinics are often run by the public health districts in North Dakota, and making sure that they're aware of, if in their screening process they find some concerns that were around, that's a possibility. And then our Department of Health Children's Special Health Services unit has and funds a variety of different kinds of clinics around the state, many of them involved in screening or specific condition assessments and evaluations. And those are ways that we're able to find, at times, children who might fit that definition. At this point, I'm going to turn it over to Hillary. And Hillary, let me know when you need the slide advanced.
Okay, thanks. So if a child and a family go through the screening process, and we'll talk a little bit about screening and referrals and then monitoring of those developmental milestones. But to begin with, if a child is screened and then evaluated and diagnosed with deaf blindness or any of the other disability categories covered under IDEA, there's a spectrum of services that are provided depending on the age group. So age 3 really kind of changes those services, but birth to 3 are Part C early intervention services. And so why this is so important is because we know that the earlier a child who needs services can get those interventions on a consistent basis, the better the outcome. And so if a child is not diagnosed or given services until the school age years, they've lost potentially 3 years of early intervention services. And so catching up or recouping some of those skills is going to be much more difficult than it would be if we caught them early and we're able to enroll them in those early intervention services. After age 3, they would transition to school age services, Part B, so transition to preschool, and would be on an IEP at that point. So I should mention that in early intervention, they're on an IFSP, and then would transition to a traditional IEP when they're school age. And so the continuation of services can be there, and actually it's a smoother transition if a child is first identified through the screening and evaluation component and is able to access the early intervention services. The transition to Part B services is really more seamless because you have an entire team helping that family, that child, transition to Part B services. When a child is not identified until they are school age, there's still a lag in services then because they have to be evaluated, set up in the IEP, and so the services are not going to be as quickly available on a consistent basis as they would have been if they were identified early. Okay, next slide. So early intervention Part C services, for those of you who are not familiar, I know a lot of you on our call tonight are very familiar with them, but just in case others are not, Part C again is that early intervention. It's a statewide system that coordinates services to parents and then infants and toddlers with disabilities or developmental delays. I think the most important part that I find in for early intervention services is that the parents are incorporated. So the parents can help come up with goals and family goals of what they want to see built into that IFSP. I think there's that harsh transition when you become school age, because it mainly focuses on that child. And while parents are important team members on the IEP process, there's not family specific goals that are written in like on an IFSP. They're more educational on the IEP. So they would be serviced by a local early intervention team. Typically, there's a service coordinator, the service providers, the family. Ideally, the services are provided in the home in a natural setting. And in North Dakota, the process is to really involve the parents. It's a care and coach model, so that the parents can really see what the early intervention team is doing, how they're doing it, what they're working on, so that there's carryover and the family continues to work on it. So it's very much a team effort. It's, the provider comes in and speaks with the family, and the family really has a lot of input and can provide those carryover activities that they've learned through the early interventionist to continue working with their child. They develop a coordinated plan. I keep saying the IFSP, I should say it's the Individualized Family Service Plan. And again, the parents really have a lot of input into that. And so it really is this coordinated effort where the family is heavily involved with the child and the service providers. And so that's kind of in a nutshell what the early intervention services would look like. Okay, next slide. Here's just a quick picture of North Dakota, and you can see how our state is divided into different regions. Once this PowerPoint is sent out, you can click on those links below, and that will give you all of the contact information for how to how to contact the centers in the human service centers in that region, which is where a lot of the early intervention services are housed. So for example, if you call the Minot Human Service Center, they can get you in contact and give you all the information you need to set up with a service provider and an evaluation with our early intervention program at Minot State. So this is kind of a very first step. Certainly not every program is housed in the human service centers, and I think some things are kind of changing throughout the state. But as a quick reference point, this would be a good start for providers and families across the state to know which region they're in and how to get information on how to have that child evaluated for early intervention services. Okay, next slide. And this is a link to Part B services, so special education at the school age level through the Department of Public Instruction. So again, if a child is not identified while they're in the early intervention years 0 to 3, and then a concern arises or a diagnosis was given, DPI can then begin to start services and get that child on an IEP plan. And so here's just a link to the special education department's website that gives a whole host of information about different categorical disabilities and how to access services within each region. Okay, so Brent talked a little bit about the importance of screening. And so we know that screening is done sometimes on an inconsistent basis. So if a child may only be going in for well checks, and that's the only time they're being screened for those developmental milestones, or maybe they miss those checkups, and so they're not being seen on in a consistent way, there's really no great way to know if a child is meeting their developmental milestones. And so monitoring when done in conjunction with screening is kind of that gold standard of what should be done. So monitoring is really when you look at those milestones on a consistent basis. And I'm going to talk a little bit about ways that can be done. And so when we think about monitoring, I think of it in two ways. first, we can go through these checklists to see where our child is in the different developmental domains. And if they're on track, it's reason to celebrate. So for parents, providers, they can say, my child is doing these things that are developmentally appropriate. It can kind of give you a sense of relief. For first-time parents who don't know what these milestones look like, it gives them confirmation, and they know that, like I said, their child is on track, and it's a reason to celebrate. If we find that they're not on track, then using the different monitoring tools gives the parents information, and kind of that confidence to go to their medical provider or a school and say, I have concerns specifically in these areas. And it really opens the door for a conversation to get services started. And so it's a way to track and monitor on a consistent basis, so that if a child is not meeting those milestones, we can find that child earlier and get them services in a much sooner fashion. Okay, next slide. So this is just a kind of a diagram of when we think about developmental screening and monitoring, and then how they overlay on each other. And so again, the screening process is more formal. There's recommended age times that they should be done for specific screening specific screening tools. They're typically done by medical professionals or teachers with specialized training. When we think of monitoring, it can really be done by anyone who knows a child well. So parents, teachers, caregivers, other family members. Again, it's an ongoing process that begins at birth. And so while there are age ranges where we want to see those milestones achieved, there's not a specific, it doesn't need to be done at a specific time. It can, you can do things in between two different age months if they weren't done earlier or later. So one of the sample tools that I'm going to go over, and this is going to be very brief because this is a topical call all in itself, but are the CDC's materials, Learn the Signs, Act Early. And this has been an ongoing effort for over 10 years that the CDC has developed these materials. They're constantly revising them and have ambassadors across the country for each state to help disseminate and teach about these tools. So I am North Dakota's ambassador, so I thought this was a great opportunity, since we're talking about screening and monitoring, to just introduce some of these tools. So the link here will bring you directly to the CDC's website, and the CDC has so much information, and so this will bring you specifically to the Learn the Signs, Act Early page. Like I said, I'll just go over some very brief materials, but I should say all of these materials are free. They're not copyrighted. So if you go to the site and wanted to order materials, they have PDFs that you can print your own materials and disseminate them out. We want you to do that. We would love for you to do that. And there's no copyright law against them. Okay, next slide. So just a couple, these are some of my favorite tools that the CDC has developed. So the first one is the Milestone Tracker app. And so this is available on smartphone devices. You can download it. This one is just, it's just so cool because you can import as many children as you want. So if you are a parent and you have 5 children, if you are an early Head Start provider and you have 20 children in your classroom, you can put all of them in. All of the milestones or the checklists go from 2 months to 5 years. The CDC is right now working to try to expand that to 7 years, but right now 5 is where the materials do end. So what you would do is you go through, import your child's birth date. You can even correct it if that baby was a preemie, and it will correct that age for you and give you the milestones appropriate for that age range up to age 2. So it asks you questions about different developmental areas. So social emotional, speech and language, gross motor, and you just go through and answer questions. What I think is really neat on the updated part of this, since they've revamped the app, they will give you picture and video examples of what those milestones should look like. So if they're asking for something and a parent's not quite sure how to answer it, you can press play on the video and it will give an example of a child at that age doing that milestone, to give a better understanding of what that looks like. So it's an accurate checklist. So at the end of it, when you answer everything, it'll give you a summary that you can email to yourself, to your provider. You can print it out so you have that hard copy result with you. It will give you reminders. So if you do it at 18 months, it will give you a reminder at 2 years. It's time for you to update the checklist for so-and-so. And so I think it's really neat because it will give you those reminders. They give you tips of how you can help enhance some of those milestones, help develop those milestones. So different games you could play, just different things, tips that parents and providers can do for that child. And then if you have upcoming appointments, you can put those in there and it serves as a calendar for you too. So reminder appointments can be put in. So that app, you can just do a search for it on your smartphone device and then download it. Or you can go to the CDC website for some more information. The other ones are the milestone moments books. So they have the same checklists that would be in the app, but it's all in one condensed booklet. So I know some parents like to have a book that they can flip back through and see how they answered it and see how they've tracked their child. So this is just in a bound book form. It's in color, it has a glossy cover, but I think this again is really nice because if a parent fills this out and they see, gosh, my child is not hitting some of these milestones, when they make an appointment with their medical provider, they can take this book with them and say, here are where my concerns are. Because I've heard it so many times for parents, they say, I just have this feeling, I'm not sure, and something's kind of off with my child, and the doctor says, let's just wait 6 months and see what happens after that. Well, now we've lost 6 months that a child could have been enrolled in early intervention services that we're not getting back. And so what these materials do are really empower parents to know their child, to know what those milestones look like, and to start that conversation with the people that can help their children ultimately. And then quickly, the other ones, there's actually 3 of them. There's a 1-year-old board book, the Where is Bear book, and the Amazing Me. It's Busy Being 3. And so what I love about these, it really encourages reading with your child. They're bright colored books, but what's really cool about them is as you're flipping through them, there's little leaf icons on the pages that prompt the parents to think about that milestone that may be happening in the story, and if their child is doing that milestone. And so it engages parents, it gives them an opportunity to read with their child, but then it's teaching and giving these little tidbits along the way too. So it's just those are just some really brief materials that the CDC offers. If anyone's interested or has questions on those later, we can certainly talk about it, or I can send you my contact information and I can make sure that you get those materials. Okay, next slide. Okay, and this is back to Brent.
Okay. Thank you, Hillary. Just the materials that you have for families, for early intervention providers, for early childhood folks are just phenomenal. They're hands-on, they're easy to use, they're free. Those are great tools to get started in that process. The next 2 things that I want to share with you are the works of mostly our partners in North Dakota. And the first one is the North Dakota's Infant Hearing Roadmap. Our North Dakota EDDI project has put together a process for What happens to a child in North Dakota who might be, who is suspected of or has hearing loss very, very early? As you know, EDI projects throughout the country have really promoted hearing screenings in newborns before they leave the birthing environment, the birthing hospital, a birthing clinic, that type of thing. And their process is to screen before the child is 1 month old, to diagnose if there is or is not a disability or a hearing problem before 3 months, and to make sure that if there is a diagnosed hearing loss, that there is intervention to the child before 6 months. So that 1-3-6 process is kind of a national process in EDI programs. And what North Dakota has done is put together a little roadmap here that says along the way, here are the things that happen. And I'm not going to go into all the details. I'm not the actual specialist in all of these, but we can connect you with all of the people who are involved in the EDI project, the birthing hospital personnel, the physicians, the audiologists, and the outreach specialists through the North Dakota School for the Deaf, about how that process works. So there's screening that is handled before 1 month of age. There's diagnosis, so there's a referral to audiologists or other hearing specialists to either confirm or not confirm a hearing loss. And if a hearing loss is confirmed, you can see they're connected to family support programs, they're connected with ENTs, they're connected with early intervention or Part C programs, as Hillary talked about earlier. And then they get into that early intervention if they're qualifying that for that. So there's the early intervention services, which is not only in our state Part C, but our School for the Deaf actually has an outreach program that can provide direct services to children and families, whether or not they qualify. And again, most cases they likely will. So there's that roadmap that gives a good depiction there for the infant hearing screening and diagnosis and intervention process. And that's pretty typical. Many states, many EDI programs across the country have these kinds of things. And so one of our previous staff members, Kathy Harstead, worked with people from North Dakota Vision Services, worked with some audiologists, worked with a number of people across the state to develop a roadmap on vision. And they have screening, diagnosis, and early intervention. I thought it was nice, and it took me, an old guy, a long time to figure out, oh yeah, that's an eye. And they put this together because it's not quite as linear a process, according to the specialists, for what happens in the screening, and particularly the diagnosis and intervention pieces for vision. And there are spots along the way of whether or not there are going to be problems. What do you do if there are no problems? Okay, that's good, but maybe you want to check a little bit later. So these two roadmaps, these two processes give a visual depiction of what it is like to go through that for young children in North Dakota. And I believe these are finalized now. I think that we have the latest version from EDI, and this was the last version for the vision roadmap. And those are things that are available. You can just ask us for those. They'll be in PDF form, so you can print them. And they're great for families, they're great for providers, they're great for something that we're going to try and get into physicians' offices so that physicians know what the next steps are. That's just an important piece in that whole early identification schema of what's happening or what needs to happen for these children. So we're running out of time here. We want to make sure we have plenty of time for questions. We just want to let folks know that as you're thinking about this and helping try and identify children who might be deafblind, in North Dakota, what can we offer you as a project? Well, we can tell you about the processes that are involved. We have names and phone numbers and contacts for people in the vision area, in the hearing area, in the special healthcare needs area, where we can get that information to you or to families. We can make those connections to specialists. We can get you print resources either to the families, to the providers, or both, or online resources on various conditions. If in fact a diagnosis comes along and it says charge syndrome, well, what is that? What happens there? What do we do about that? We have that availability. We can give information on evidence-based practices. And Hillary talked about, and I'm so glad she did that because it sets up for the next topical call we'll be doing, or the extended learning call we'll be doing later this month. The books, the milestone moments in the books there, particularly at this age, it's about communication. And in prepping for inclusion into the regular education, early literacy is big, 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 big. And evidence-based practices on early intervention, but also on feeding, on sleep, on other developmental activities and other educational activities. We can access evidence-based practices and family and parent resources and information. We've supported families to go to the National Charge Conference. We've been able to provide a host of resources, both in print, phone calls to families about what they need and where they would go for services. So that is our presentation tonight. Again, our contact information there, if you go to the www.ndcpd.org and you hit projects, you'll see a list of projects that are funded. Our dual sensory project is there. We want to thank OSEP for their support and Department of Public Instruction in North Dakota for their support in making this project go on. And then people like Deneen and Family Voices and Hands and Voices and outreach from Vision Services and School for the Deaf and the school personnel who have been involved in this. It's just been an absolute blessing to be able to have those links. So, and those linkages and those networks. It looks like, yes, thank you, Rebecca. The background for all of our state deafblind projects is at the national NCDB National Deafblind Program and all of the state projects. So if you happen to be working with children who are on the border, and some of our providers work with kids across borders, right? And so if they're in South Dakota, Montana, and Minnesota, and where are their projects, that's all there. That's excellent. So,
Brent, I do have a couple questions.
Yes.
Because this really kind of spurred, maybe because it's the legislative session, but anyhow, the first question I have, let's just say for an example, you know of families that have a CVI, but they don't necessarily have the blindness. Mm-hmm. Or no, the hearing impairment, I want to say.
Yep. Yep.
Is this project something that would be able to help them also or not?
Well, we've supported folks to get that CVI training, and we know who they are, and we can make a recommendation for here's a person you can talk to. They wouldn't necessarily fit our census and probably wouldn't fit that definition of deafblind. But I want to say this, Deneen, sometimes they'll say, well, things are okay, vision's not a concern. But when we start looking at the files once in a while, it shows, well, the child has a progressive vision or hearing loss, or the child has, but it might not be a problem now, but it might be in the future. Well, in those cases, those children likely would qualify for being on our census. Okay. And so, yeah, come to us on that, and we'll send them in the right directions.
Okay. And then, so the other comment I had, only because there was a bill that many of us testified on yesterday, but I'm a little worried about what happens to these families after early intervention, especially when they're on the Birth to 3 program or in early intervention. They're most likely on the DD waiver. And then when they turn 3, they probably don't screen eligible unless they have that ID diagnosis. So I'm sure that these families get lost in the shuffle, really, as far as further assistance to pay for therapies and all of the access that they probably need. So I'm hoping, Senate, I'm just gonna put a pitch for it. Senate Bill 2256, if you have families that you know, we're requesting a study to be done in the state of North Dakota for all those families that have a child that have a developmental disability but don't qualify for the waivers.
Yeah.
Because there are a lot, and we really need to work on that. So I'm worried about those families. And then a couple other comments I had. Hillary, if you would put on your
Deneen, could I jump in on that one for 1 second?
Yep.
Is that the children may not qualify for developmental disability services if they have deafness, they're blind, and don't show an intellectual disability. They may not qualify for the waiver, but vision services out of Grand Forks, and they have outreach offices across the state. North Dakota School for the Blind has outreach programs, and we're working really closely. And hopefully Rebecca will appreciate this. We're trying to work on a systems change thing where they're working together a little more closely on that. And those are places where we can't come in and provide the service. They can provide outreach services, as long as they have in their mind one of those. It's not the same. It doesn't give them access to some of the other funding streams and stuff, but it's not like they wouldn't have anything. It might not be perfect, but it might be something. And pray to goodness that you and Roxanne and the rest of the people who are working on this get that passed so that nothing gets taken away at this session anyway. So I'm sorry, I just wanted to jump in there. So
yeah, thanks. And then Hillary, just 2 more things. If you could make yourself a note, our next snail mail newsletter is going to go out probably like a back to school issue, our hard copy issue. And I would really love an Act Early article in there.
Sure. Yeah. Just let me know the deadline, because I will stretch it out to the deadline if you let me.
I do the same. And then I also wondered if there couldn't be some kind of a unified poster for the hospitals, rate tracks, early intervention, us, early childhood programs on some of those Act Early materials, so that people know, even the birthing hospitals, to identify that those materials are there and able to download those. I think that would be great too. And if there's any social media that goes out, we could certainly help put that out too. Okay, I'm going to shut up now.
No, I appreciate that. I think we're starting to work with more groups of people who touch different parts of the states in different capacities to teach them about the materials. But I love the idea of having one kind of cohesive document that shows all of the materials, or at least links and things like that. So thanks. Yeah, thank you.
And Deneen, I would just jump in on that. That's part of this, if you call it early identification, like a child find. That's part of our child find process actually in the dual sensory project too. And that's something that we could provide some financial and logistics supports on. We've not been able to get into some of those offices that you talked about very well. And I think this would be entree, hopefully, for everybody in that and pull that together.
Yeah.
Well, and this is Roxanne. I mean, one of the best vehicles, Deneen, is probably the newborn screening advisory.
Yeah.
Because already, I mean, they're already, connected to the hearing screening. And they know who all the right people are.
Yep. Good. Other questions that people might have?
Brent, I just think you should write a history of disability in North Dakota. I don't know how broad you want to go, but I just like, you know, like I'm really pretty serious about it. I mean, I know you
Yeah.
did that state developmental center piece, and
So in my file cabinet, I have a set of files on the North Dakota history of the Deaf Blind Project. And Bob Severson, if you recall,
Yes.
Bob Severson, long time provider in North Dakota. He was the very first project director. And prior to his death, it'll be what, almost 2.5 years ago now, he and I were working on the book, and we were going through the process. Some things happened in my life that changed, and then Bob died. And a week before he died, he called me and he said, Brent, you need to get this book written. And when you do, please give this to, and he gave me a name I have written down somewhere. He gave me a name. This is the person who's doing my hospice before I die. And so the book is going to be dedicated to him. He's going to be a co-author on the book. He gave me so many materials. And that's going to be my next year and a half project in retirement, is trying to get that book about the history of, because as you know, from 94 through 99, I was the project director on this. And so then I went 19 years almost, 19 years before I'm back at it again. So it's, the horse is bigger and going way faster now than it was a long time ago. So
that's great.
Yeah.
That is great.
There was a another resource here. Rebecca put up here another federally funded national project at HHS, looking at improving early vision and screening and referral. It's through the National Center on Prevent Blindness. Okay, nice, good.
Any other questions at all for Brent and Hillary? Denise, Samantha, Joan, Michelle? Don't be shy. Because God knows I'm not.
I don't have any questions. I think it's always good. I really love the visuals, and I know as a parent I would have loved that early milestone app, and I really think that could be useful.
Mm-hmm.
Hillary, if you have a link to that, I'll share that on the Family Voices page. I think a lot of even families that don't have kids with a disability would like that app. That'd be
Oh
great.
yeah, I mean it should be used universally, you know,
Yeah.
just like I said, to celebrate when they're meeting them, and just to really teach parents. So I don't have a link specifically to that app. You can look, you know, if you're on your iPhone, you can do a search in the app store and put in the name of that. But that link that's within the PowerPoint will bring you to the main Act Early webpage that will link all of the materials that they have.
Okay.
And if you get to the CDC website on NCBDD, and you just put in app, it'll take you, well, probably take you a bunch of apps, but you'll be able to see it there. So
Nice.
Hillary, is there any, I don't know how to run it. I mean, obviously you've probably talked to our Part C office. Is there any active ongoing connection between our major Right Track program and Learn the Signs at this point?
So I have the Ambassador Project, and then there's a second project that was funded. And for that I have an advisory board, and Jackie from Part C is on that board. And so we actually just met Monday for our monthly meeting. Denine's on that board too. And so, yeah, we have someone from Department of Health, the Head Start representative between DPI and Head Starts. We have Jackie. And so we have Denine, we have someone from Pathfinders. And so we have a lot of people. But to answer your questions, yeah, we're working with Jackie. I don't know how consistently these materials are implemented. I think she mentioned that they are, but I don't know, you know, if it's a standard that every region is using the Act Early materials consistently. I would my push is for that to happen. But right now, I can't say for sure that it's 100%, but Jackie is on board and we've been working with her closely.
I'd really like family though. I mean, I just got on the Family Voices National Board, and I'm going to bring the Act Early up to them because I think they have focused so much on bright futures that I really think they also need to incorporate these materials too, because they are so well done. Yeah.
There's quite a presence at the Division of Early Childhood Conference, and connections. And actually, I serve as the chair for the family committee. And we have a couple of ambassadors on the family committee.
Well,
So-
if you want to share those materials or whatever I can do to support you in that role too on a national level, I'd be really excited to do that.
Oh yeah, like I said, Hillary, we have a couple of other state ambassadors that are on the family committee now.
Great, yeah.
New Jersey.
I can speak.
Deneen,
Sorry.
Samantha, go ahead.
Oh, I was just going to touch briefly with Roxanne's previous question. So I am a parent of a 20-month-old that has just gone through, we've done Right Track since he was born, just gone through the process of qualifying for EI with suspected hearing loss, and has done 2 screenings with an audiologist. But I can say as far as the EI part and the screening and the speech and all of that, this program was never mentioned.
Mm-hmm.
So I'm not saying that it isn't being used, but I know the Right Track person that we were dealing with was an OT.
Yeah.
And the person that came out for EI was also happened to be an OT. So that could just maybe be that it wasn't on their radar.
Sure.
So yeah, we're kind of in the middle of this process right now. We have a family, older sibling with vision impairment. So it's just something we're kind of watching for.
Mm-hmm.
And right now he's not really, how do I say, didn't pass or fail.
Yeah.
With the audiologists, they suspect that he has some hearing loss, but nothing severe. So just watching that vision impairment at the same time to see if he's going to follow in his sister's footsteps.
Yeah.
But I joined this call because I didn't know anything about this program, and I wanted to know where to look for some of the early signs. And you guys definitely answered a lot of my questions and gave some good resources. So thank you.
And thank you for being here, Samantha. And again, if you have any questions at any point along the way, and again, at this point, don't worry about severity so much right now. I mean, there's certain things that qualify under certain different programs, but if you've got questions about the hearing as well as vision or the connections there, feel free to get a hold of us. So
I appreciate that. Yeah, right now I think he's just kind of too little to know for sure. There's definitely a significant speech delay, so we're just kind of rolling with it and seeing what happens. But it's good to have the resources and to know who to ask.
Well, then make sure you got connections and get a hold of other families, because our next extended learning call with Deneen is going to be on literacy and pre-literacy and early literacy, and then for children getting into later preschool numeracy. So that whole idea of language development and book and reading and all of those kinds of things. We'll be talking about that. That'll be a little bit more specific to hands-on activities and materials than perhaps this was.
Okay, yeah, that's great. Thank you.
Thanks, Tammy. Okay, well, I think we're gonna call it a night. Thank you, Brent and Hillary, and gee, Rebecca, it's so nice to see project officers on some of our activities that we do. So we're glad that you could join us tonight for sure.
But they don't give us a budget to travel out to see our projects, but this is a nice way to kind of virtually visit. So this was great. Thank you for including me.
Sure is, and it's getting late on your side of the country. So we really appreciate that. All
Thank
right.
you, Janine.
Yep.
Thanks,
thank-
everybody.
Thank you.
I'll post this
Thank you.
tomorrow, and I'll send out the YouTube Connect to you guys tomorrow too. So
Thank
you
you.
all.
Take care.